today. We are also live on Facebook, so anyone is watching us, you are welcome. Today is all for autism panel discussion. We are discussing issues related to autism, so feel free to ask. Even if you ask on the Facebook, we will get back to you with the correct answers if you have any questions. Maharat Learning Center is established since 2017 to support all children and young adults towards their inclusion in the mainstream education and in the society. We utilize the best practice and evidence-based practice when it comes to behavioral intervention and individualized program to suit the needs of any child or adult who needs services or support. Christine, are you there? Christine?
Yeah.
She's there?
She just came on again.
Okay, perfect.
Okay.
So I'm going to introduce our panels. Our panel for today is very distinguished speakers. I'm going to start with Sausan, since you are the one on the screen. Sausan have master's degree in clinical psychology from the American University of Beirut, and then she have her master's in clinical psychology again from Columbia University in New York. And now she's doing the applied behavioral analysis. She did graduate the coursework for applied behavioral analysis from the Chicago School of Professional Psychology and from the University of California. And for the past 12 years, Sausan has been working in the field of mental health care services for individuals with additional needs and school inclusion. She is now working towards becoming a board certified behavioral analyst. In parallel, she is completing the training coursework to allow her to do cognitive behavioral therapy and in clinically treating individuals with trauma and attachment and counseling families and parents and parental training. So welcome with me, Ms. Sausan Sarrazouk.
Thank you very much.
Our second panelist is Nicola O'Reilly. Nicola, originally from Ireland, completed her bachelor in occupational therapy from Trinity College in Dublin, and then obtained her postgraduate certificate in sensory integration at Ulster University. She's licensed in Dubai as an occupational therapist and registered with the Healthcare Professional Council in the UK. She is also a member of the Royal College of Occupational Therapists and the Sensory Integration Network in the United Kingdom. She has been working for the last few years with Maharat and Child Early Intervention Center to provide children and with sensory integration difficulties and motor coordination difficulties and functional performance in everyday activities. So welcome with me, please, Ms. Nicola O'Reilly.
Thank you, Dr.
You're welcome. Our third panelist is Salma Hamdi. Salma is a speech and language therapist, and she has a few years of experience working with children, and she just joined Maharat recently, so welcome, Salma. The fourth panelist is Christine de Serkisian. I think she's just joined us. Can you open your camera, please, Christine?
Yes, I'm here.
Christine is the former president of the Association for Behavioral Analysis in Lebanon. Christine provides children and young adults with behavioral programs to prepare them for inclusion and support them in mainstream education. She obtained her bachelor degree in clinical psychology from University of St. Joseph and her master's in psychology and applied behavioral analysis from Capella University. She began training her ABA in 2005, first in London and then in Dubai. She's also the co-founder and general manager of Carrie Early Behavioral Intervention Specialized Ambassadors, EBISA. She is also the project coordinator and trainer for Autism Technician Development Program in Jordan. She's also a counseling supervisor for Maharat Learning Center in our Riyadh branch. Christine has practical experience in teaching and a varied record on assessment and designing individualized program for children and young adults affected with developmental delays and with autism. Please welcome Christine de Serkisian. Our last panelist is Carrie Mcmillan Green. Carrie is the program director at Maharat Learning Center. She graduated and received her bachelor in psychology from Auburn University in Alabama. And then she received a master's in science in applied behavioral analysis in developmental disability from the same university. Carrie received her certification from Behavior Analyst Certification Board in 2004 and became a board certified behavioral analyst. She's been working in the field of autism for the last 17 years, setting programs for adults, children, day centers, both in America and in Europe. She has worked with individuals from the age of 2 to the age of 50 across a vast behavioral repertoire. I would like to welcome also Carrie. I think she will join us in a few minutes. So we will start until she can join us because we don't want our guest to wait.
I'm here. Thank you.
Hi, okay, you're here. We cannot see you.
Oh, can you not see me?
No, we can see you now.
See you.
Okay.
All right, perfect. So thank you all. We're here to join forces and help our parents and people who are attending the seminar, this panel discussion, to understand autism better and to understand the challenges and understand the solutions. So let me speak about behavioral therapy, because I can see that we are a lot of behavioral therapists, and everybody hears about ABA therapy. Many parents don't understand what is behavioral therapy and why it is important in any early intervention program. So I will give that microphone for you, Carrie, to explain to our audience what is ABA therapy.
Hi, everyone. So ABA therapy is, it's the science of behavior. So we take the principles of behavior and we apply it in a way that is going to make a practical and social impact on the lives of the individual and the individual's families that we're supporting. So we kind of, the main focus is we look at the individual and we put strategies in place to develop adaptive repertoires of behavior, and we put in strategies to decrease those behaviors that are considered problematic. So obviously it ranges from, communication and speech to social and play to academics and pre-academics, to life skills to pre-vocational, vocational skills. It's anything that the individual needs for their further development.
Let me ask you this question, Carrie. Many parents or many centers are offering what we call verbal behavior, and it's part of ABA therapy. Would you explain to our audience what are the different approaches to behavioral therapy and which is the limitation and the strength of each approach? Because a lot of people don't know the difference between verbal behavior or the Discrete Trial. I mean, I would like you to elaborate a little bit so our audience can get more knowledge and understand better what are the different approaches.
Okay, yeah. So there's a lot of different ways to teach the kids that we work with. So the verbal behavior approach is where it focuses on the speaker and the listener. So, it looks at the basic, the basic form of communication, which is requesting or manding. So it kind of focuses on that for individuals. And then it goes up to kind of labeling or tacting and answering questions, filling in blanks or interverbal. So it really focuses on that aspect. And even verbal behavior can be taught in different ways. So with us, we do things in lots of different ways. So Discrete Trial is where the learner and the therapist is sitting at a table, and it's mass trials. So they kind of work on one program over and over and over again, but it's got a system to it. So there's an instruction, there's prompting methods, we get a response, and then we deliver reinforcement. And we do that over and over again for a child. And that method is great. It works really well with some individuals, with some programs, but it's not for everybody and it's not for every program. Other ways of teaching it, we call it natural environment training. Also, it's called incidental teaching, pivotal response teaching. So all of that is based on the premise of following the child or the individual's lead. So it can be thought of as kind of play-based. So we still are teaching the same kinds of programs as we would through Discrete Trial, but it seems really fun and natural for the individual. Whereas for the therapist, it is fun and natural, but in their head, they know what they're teaching. They know the prompting methods. They're just doing it in in a different kind of way. So, and those, the natural environment or the incidental teaching method, why that could be better than discrete trial is it promotes natural generalization of skills. So one of the issues with discrete trial is that, you know, the individual learns certain skills at the table using artificial materials. So, you know, 2D stimuli, flashcards, things like that. They're not using it naturally in the real world. So with discrete trial, to make a skill useful, you would have to target then to generalize the skill with different materials, different people, different situation. Whereas natural environment or incidental teaching, that is, you're teaching generalization naturally. So it's more natural, it's quicker. You don't have to then target generalization specifically.
Thank you very much, Carrie. If anyone have question, please post your question on the chat and we are happy to answer your questions. My second question will be for Nicola. Nicola, you are an occupational therapist, and many people don't know what is occupational therapy and why is it important to consider for children, especially the ones with autism and sensory issues?
Yes, so within occupational therapy, we really look at function and developing skills. So children with autism often present with differences in how they perceive, process, and integrate sensory information. So we've got like the 5 senses that everybody knows about, which is like our vision, our hearing, our taste, touch, and smell. But we've also got 2 other senses which really affect our ability to engage and our attention levels. And they are our vestibular sense, which perceives our head movement and our balance, and our proprioception, which perceives our body position awareness. And children with autism tend to have differences in how they perceive these senses. And where we see issues is when a child has either a very high threshold for sensory information or a very low threshold for sensory information. So a child with a very high threshold for sensory information, they may present like they are not really registering what's going on in their environment. So they may kind of appear like they're in their own little world a little bit. Or they may also appear like they're constantly seeking out sensory information. So this could be the child who moves a lot, is constantly touching things, maybe licking, smelling things. So they're constantly seeking out sensory input because they've got such a high threshold. We've also got children who have a very low threshold. So these are our children who are very sensitive to sensory information. So they may be sensitive to the clothes they wear, they may be sensitive to movement, they may not like to go on a swing, they may cover their ears a lot in like loud environments or busy environments. And they may like avoid certain activities because of their low threshold for sensory input. So occupational therapy can assess a child, assess their sensory systems, and then devise like a program of specific activities that will aim to promote development in their different sensory systems.
Thank you, Nicola. And I know that a lot of kids find it difficult for transitioning, for example, in a supermarket or going to a hairdresser, and many parents are finding difficulties. So occupational therapy help to desensitize, in my own words, the kid, or it just help him to understand how to cope with these thresholds? Or
yes, normally
you
it's
teach him how to
combination.
cope, or you really make him less sensitive or more sensitive?
Yeah, normally it's a combination of both. So our senses heighten when we are fearful right? So by preparing a child and helping them stay calm, reduce the flight or freeze mode will then help to keep the child calm, and their senses then tend to be not as sensitive. But within therapy sessions, we're also working on integrating all their senses, so it does have that kind of desensitization effect.
And I'm going to ask you one more question, is when do we stop OT? Is there any time when they should not, like they don't need it anymore, or it is something that they will have to take the rest of their life?
Yeah, it will definitely depend on each child. But what I do find is for younger children, we tend to use a more bottom-up approach. And that means that we're really working on the core skills in order to complete tasks. Whereas with older children, say teenagers or young adults, we tend to use more of a top-down approach, which means that we're looking at specific tasks or skills that the child is having difficulty with, and we're really just focusing on them. So what I would say for parents who are wondering if like their older child still needs OT is to consider three things. That would be think about their self-care, their productivity, which is like schoolwork or college work, or maybe it is actual work, and their leisure, so their leisure activities. And if they have any difficulties in any one of these three areas, it may be helpful to have an OT assessment, and that assessment could just involve the OT supporting the parent to look at where the difficulties are, and then prioritize things to work on. So it might be, okay, let's set goals for the next academic year in these three areas. So it doesn't necessarily mean that the young adult or teenager would be attending sessions on a regular, like weekly basis as younger children might do. So it may be more that kind of a dip in and out, come get some support, go away, work on these skills. And then what we find is the children will also come back because then they have new challenges. So the next year as they develop, they may face something new. It might be, okay, now it's time to learn to ride a bicycle, or now it's time to learn how to type, or it might be organization for high school. So it just really depends. So I wouldn't say there's a specific time to stop OT, but I would say for each child, it will depend on if we see, okay, they're progressing really well, they're doing so good. Sometimes I would say to parents, okay, why don't you take a break? And if any new issues arise, come back and we can talk about it and set some new goals.
Excellent. My next question will be for Salma, because many people just seek help because these children are not speaking or having a speech delay, or they find it difficult to communicate with their kids. Salma, what are the most common speech issue that you have faced with children with autism?
Sorry, children in general or autistic child?
Children with autism on the spectrum. Today we are focusing on autism.
Children with autism? Yes, for sure. Children with autism had the challenges with communication and social skills. So some of the children are autism children are non-verbal, that they have a problem in eye contact and have a problem in gestures, and they can point things to things to express. They have a problem in receptive language. Receptive language is comprehension of the language, how they can understanding language, and also have a problem in expressive language, how they can express their needs, how they can say just one word or just pointing to things to express what they are needing, or naming the things, labeling the things that are around them. This is the common problem that I can face with the autistic child.
Thank you. So when it comes to speech, do you do assessment for the child? Because I remember, I know that we need to do assessment for the children, but I want our audience to understand that sometimes we see speech therapists just putting puzzles together and things, and there is no assessment, there's no program. And I just want to elaborate how important it is to be very structured when you assess the child. What kind of tools, what are you assessing when you're assessing the child? And then when you're doing a program, what are the things that you really want to focus on based on your assessment?
Okay. Firstly, for the child, when he comes to our center, we have to assess them depending on his language level. We can assess him on his pre-linguistic level. We can assess him in his receptive language, his expressive language, how he can express, he has words or not, he can express or not, he can understand the language or not. For sure, we have standardized assessments in our center to evaluate and assess the child. The tools that we can use, we can also assess the oral mechanism for the child. If the tongue is okay, if the teeth and the jaw and the tracts is okay, so there is no problem to articulate. And then for also the receptive language, we can assess the receptive language and the expressive language. As I said, that we have a centralized assessment in our center to assess the child in speech and language assessments. And the tools we can use, the flashcards and the tools that like the vegetables and fruits and like this, that we can ask the child if he knows this or not.
So once you do the assessment, you are able to put a specific program, individualized program for the child.
Yes, for sure. Once I assess the child, I can put an treatment plan for the child. It depends on his language level.
And we hear about multidisciplinary approach. Carrie, you might also answer this question.
Yes, for sure.
We talk about multidisciplinary approach, and does that mean speech and OT and behavioral and psychology work together towards developing a plan for the child?
Yeah, well, there's multidisciplinary and there's also interdisciplinary. So multidisciplinary would be more that, the different departments, ABA, OT, SLT would work together. They would have their own separate plans, right? So they would have their own separate speech and OT and ABA plans, but with common clients, they would meet regularly, maybe overlap each other's sessions to make sure that things in ABA are being transferred to OT where relevant. Certain speech goals are being incorporated into ABA where relevant. Interdisciplinary, I think, is more where there's one plan and all of the different departments feed into that one plan and everybody is a part of running that one plan. So I think both approaches are really, really great. I've worked in places that do both approaches. Within Maharat, we're definitely multidisciplinary, so we for sure communicate with each other regularly, and we have clinical meetings about clients. But I mean, it's essential. You have to. You just have to, because there's very important things that come from each person working with the client, and we need all of the relevant information to help move that individual forward.
My next question will be for Christine. Hi, Christine.
Hello.
Hi, Christine. You've been working with teenage children and transitioning to adulthood, transitioning from being a child at the age of 12, 13, and becoming more like a man or like a lady. The child goes through a transformation when it comes to hormonal change, physical change, mood change. A lot of times we'll see them moody and aggressive and sensitive and emotional. What are there specific programs to suit the needs of a teenage? And if so, what are these programs? I mean, know that
Yes.
so many parents have issues when it comes to teenage time.
Yes, as we know, each age has its program, its life challenges, and its barriers. Every individual during its development is having his challenges. And as you mentioned, Dr. Hiba, that during adolescence or during the transition to adulthood, we will be facing other additional challenges due to biological changes, the individual not understanding what's happening in his body, and all those frustration, or maybe he becomes more aware of his environment and the behavior of the people around him. So definitely we will have programs for this. We will have programs for to prepare to life skills, as we have started at earlier ages to functional skills. So we will have life skills programs. We will also have functional skills that are related to his daily self-help and living skills. And in addition, we will have more training to his integration into the future or the adulthood, or preparation to vocational program, or preparation to any future enrollment he will have, the individual will have. So yes, we will have individual specific programs regarding the challenges and the strengths the person have and where they fit. And we do the proper orientation where they fit in the coming phase.
Carrie, are you aware of specific programs that are suitable for teenage, like life skills program?
Sorry, I forgot how to unmute it. Yes, sorry. There are, there's the ASDAN program. So we do ASDAN for a lot of our individuals who tend to be kind of 13 and up. They can be in school or not. Most of the kids, most of the individuals that we're doing ASDAN with tend to not be in school, because ASDAN has a very functional route. So it focuses on functional daily living skills, pre-vocational, vocational skills, that sort of thing. So that's a really great program that we do. There's different assessments as well that give us ideas to develop within the ABA program. So we do the assessment of functional living skills assessment, assessment of functional living skills.
Essential for living.
Sorry?
The essential for living.
Living skills, yeah.
Yeah, the assessment of functional living skills is the APLS. So we do that a lot, and that just gives us more ideas about what to target for some of our older kids within their ABA program.
Thank you very much. I will move to Sausan. We didn't hear you. I wanted you to talk about inclusion. And I know that you do a lot of training when it comes to what are the best strategies for inclusion and when it is the right time usually we do early intervention, and the aim is to move the child into the school. Sometimes the child is not ready. So I wanted the parents to understand, when is the child ready to be in school? It means everybody, when the child hits 4 or 5 years, want their kids to be in school, but they might not necessarily be ready. So if you can elaborate on when is it he's ready, and what is the best strategy when it comes to inclusion?
So that's a very loaded question. So I want to give you a two-part answer. So the best strategy sum it up with one phrase, it has to do with collaboration between the family and the school, and if there's a service provider, such as all of us today, like speech therapists or ABA therapists, they all have to be involved from the second the child starts school, regardless of how much he or she are included in the mainstream classes, or if it's a special ed class, everyone needs to be aligned. It's almost like a triangle. And the other thing that you asked me about, I think that's a really a big question, because there is no one way to decide if a child is ready for school. We need to see, first of all, the abilities of the child, the challenges that they have. Are there enough strengths that they can use to compensate for the challenges? And then we have to put in a very specific plan rooted in evidence-based strategies. That's why our ABA department were very heavily involved in And we need to get the parents on board to understand that there's a reason why this child is not being recommended to school. And then there's always data and everything that shows when they are finally able to go to schools. And when they do, we have to look at schools that are not using a cookie cutter approach with their individual education plans. We need our child to really be taken care of. As I said, everyone to collaborate in setting goals. Otherwise, we're setting the child up for failure. So yeah, I would really always focus on collaboration and being very careful with setting our goals, making sure they're smart goals, and then taking it from there. The child eventually will lead us, whether or not they are really ready or not, or they won't succeed in mainstream education.
Thank you, Susan. I'll just briefly summarize that if a child to be assessed to be ready for school, they need to have some skills for communication, some skills for being able to, you know, to be safe and right. Am I?
Absolutely, yeah. They
yes,
have they're called school.
And then also we want to see that the school is ready to support the child whenever he's not ready, that they have some methodology to help him to be included. I would move to Carrie and ask about transitioning to university. We're talking about transitioning a child to school. You need to have a basic skills to help him to be in the school. The way I understood is that the child have to understand reading or writing in order to be able to be in the same level of his peers. But when we're talking about transitioning to university, we're talking about students in high school level, you know, grade 8 and 9 and 10. So how can we make their transition to university or to vocational program an easy one, you know, challenge-free or stress-free, especially for parents?
Yeah, well, I think if we're talking about transitioning to university, then we are assuming that that individual, you know, has the academic skills. Because I mean, if this child is in high school and they've been successful, you know, through their school years, and they're in high school and it's still being successful, then we assume that they have the academic skills necessary, even if that's supported through an IEP and through a school shadow. So even, you know, with that, if they're still keeping up more or less within 2 years of their age group, then they can transition to university. So the main aspects then would be looking at what supports can we keep in place with university. So in universities, it's different than schools. They don't have to have an IEP. There won't be an IEP really. But most universities are really coming into the whole inclusion, you know, how to help kids with additional needs and that sort of thing. So, you know, every university will be a little bit different. You have to decide as well, does the individual still need a shadow with them to go to university? I know we support an individual who goes to university in Dubai, and he has his shadows with him. It's different. They don't sit with him in class. They sit further away, that sort of thing. And I would imagine, you know, in addition to helping them, you know, with some modifications with the academics, it's still a big focus on their social skills, because social skills from high school to university, they change, right? So it's making sure that we're still supporting them and teaching them what they need to know socially. And even as far as their executive functioning skills, you know, university requires a great deal more of independence than high school. So making sure they're ready for that. So really, when we're thinking about transitioning an individual to university or vocational, we have to start thinking about it when a child is at least 13, 14, and thinking, you know, what route do we want them to have, you know, talk to their parents, and then start working on those skills more or less, you know, immediately then, as far as executive functioning, social skills, thinking about the supports that they're going to need at the university, talking to the university about, you know, what kind of support they will be able to offer. If it's a vocational route, it's the same type of thing. So start thinking about it early, talking to parents about what they really want for their child, talking to the child about what they really want to do, and start working on the pre-vocational skills needed for that vocational skill early. Start making connections with possible apprenticeships or employers, and maybe start doing some volunteer work with them, and, you know, so that they are aware of the kind of supports that are necessary. Think about, does that individual need a one-to-one support at work? You know, so instead of a school shadow, it turns into a job coach. So there's so many things to think about, but the earlier the better, and to get everybody involved, right?
So when we talk the earlier the better, you're talking about which grade? Like when we start to prepare the child, is it when they are in grade 8, grade 9, grade 6? At which level do you think it is important for us to prepare the child for that transition?
I think if we're talking about something like university, I think probably at least grade 9 when they're in secondary school, or if it's grade 8 when they're in secondary school, because that we need to start the discussions with the secondary school, because they have a role in the transition as well.
And it give us more time also to work on skills for years, better than just try to do it all.
Yeah. Oh, I think you're muted, Dr. Eva.
I have a tricky question, because a lot of time when we talk about communication, AAC devices and alternative communication, the way ABA therapy use it and the way speech therapy use it are not the same. The speech therapy maybe use it for developing the language, while the in the ABA it's more used for the practical communication. I would like our parents to understand when it is important, because sometimes the child is nonverbal or pre-verbal or paraverbal, you know, like we have all these names. But when it is the right time to start using AAC device, and I have met parents who are reluctant to use it. They don't want it. They want the child to start to speak. But then the child is deprived of a voice. And I feel like, no, it's okay. You can get him, you can work on speech development, but you still have to give him a tool to communicate. So what is your thoughts on that?
So I am a big proponent of communication, no matter what that communication looks like, right? So whether that's vocally or if it's through something like Proloquo, if it's through the traditional text, if it's sign language. And I have worked with a lot of kids where I've used this stuff with, and some then begin to talk, some don't begin to talk, but it never, ever, ever hinders the vocal speech. And there's so much research to back that up that says, if anything, sign language, Proloquo, PECS helps the vocal speech, right? So not giving a child anything and just hoping that the vocal speech is going to come is actually more detrimental than giving them PECS or Proloquo or sign language in the hopes of that vocal language will come.
Salma, do you have something to say in that regard? Salma? Can you unmute?
Yes, doctor. Yes.
When it comes to alternative communication, do you recommend it to almost all your children, or you choose based on what?
When I choose AAC or alternative augmentative communication, I have to work with both. I have to work in the traditional speech therapy session, and I can use a device or communication, alternative communication to let the child express what he needs. I have not to wait until the child reach the level that he can express. I can help him to communicate with others. How he can communicate with others, even if he can't know how to say anything or how can he express his needs. I can work together. I can let him use AAC, alternative communication device or application, beside traditional speech therapy as a session or a treatment.
And my next question will be more on feeding issues. And as far as I understood that, it is somewhere where speech and sensory integration and occupational therapy and behavioral therapy work on, especially children who are picky eaters or distaste the food or the sight of the food or difficult to feed anything. So I'll ask Nicola, where are we in terms of what the borders, what does the OT do and what is the behavioral role and what is the speech? Because I know that sometimes the speech therapists work on the muscles while the OT also work on the swallowing, and then the behavioral therapists work on the behavior. So what advice do you give the parents? I mean, if they tell you my child is picky eater, where does he go? Does he go to a behavioral therapist or an occupational therapist, or ask the speech therapist or a pediatrician? Like, where exactly? This is like a gray area for parents.
Yeah. I think definitely going to a feeding specialist is the first step. So you may go to an OT who has experience in feeding therapy. It may be an ABA therapist who specializes in feeding therapy, and similarly it might be a speech therapist. But what I would definitely advise is on depending, it doesn't matter who you go to, but it's important to look at the different factors which may be contributing to the feeding difficulties. So we do look, so if a child comes to me, or quite often they may start off in ABA and they're presenting with a feeding difficulty, and the ABA therapist may ask me to have just like a general assessment of their sensory needs, so we can determine if the feeding difficulty is related to a general sensory integration difficulty. So what we often see is a child's feeding difficulty may have started due to a sensory integration difficulty, but then a behavioral component can come along with that, because a child knows, oh, I don't like this sensation. This sensation is scary. It's repulsive. I want to avoid this at all costs. So then when they get the trigger, even if the sensory issue as they get older may have become better, they still have they still are like repulsed by certain foods just from the sight of them. And like that, it becomes then more of a behavioral thing where they have gotten to the habit of refusing certain types of food. So it definitely is important to pick apart the difficulty and kind of find out what stage of the difficulty the child is in. If it is a sensory difficulty, we then tend to work a lot on their tactile system and also their vestibular and proprioceptive system, and we coordinate very closely with the ABA team to find out, you know, what strategies they have used, if they're using something, if they're working on something specific, then that we can incorporate into the OT session as well.
So I'm going to ask this question to the ABA therapist we have. When you do a strategy for feeding therapy, you know, I'm just asking to audience, we have a lot of parents following us, and probably they will have the question is, okay, what you're going to do with my kid? How am I going to improve his? Do you do parental training, or do you put a program for the child that you follow precisely over some time?
Well, I'll answer this. So we can do both. It depends. A lot of times it is, I will say, easier, maybe quicker, if us in the ABA department start the feeding therapy on our own with the child or the individual, and then once we get to a certain point, start incorporating the parent and showing the parent the techniques and training them to do it. Because I find feeding, it's much more intrusive than, say, teaching colors or numbers. We're asking the child to put something in their mouth that they don't like the feel of, they don't like the taste of. They might even be afraid that they're going to choke on it because they don't know how to properly chew. They don't know how to properly move the food around in their mouth with their tongue, which comes in ABA or comes in OT and speech, you know, to help with those things. So it's very intrusive. So we tend to see a lot of problem behaviors with feeding. So it can be very daunting for parents to work on that and to see these problem behaviors, because a parent, rightfully and naturally so, is very emotionally tied to that. You know what I mean? So it's difficult to see those problems. Whereas in the ABA department, it's easier for us to work on those behaviors because we're not, you know, we're not as emotionally tied as parents. So it's easier. But we don't have to do that. We can certainly start with parent training and give the parents some tips. It depends on what the big problem is. You know, if it's just, you know, the child is eating, but they're a little bit picky with certain things versus the child is not eating and only taking pureed foods, right? I mean, that's a very different situation. So we can do both. Eventually parents come into the picture with feeding though.
I'm going to move to Susan and ask her about parental training since we are on the same topic of parents' involvement. You have came up with a brief parent training. Can you explain to the audience what is this training? Is it for any parent or for parents who are doing therapy for their kids, or what kind of training you're offering?
So what's unique that it can be customizable. It depends on why we are recommending it for this family. It could be that there are some restrictions or limitations that are stopping the family from providing access to our ABA therapy. So let's say it could be where they are living, or it can be a language barrier, it can be financial a lot of the times. So in that case, then we would have like a brief assessment for the child, and then put some goals for the family, and then we do a type of training that we find suitable for the family. It can be competency-based, so like very structured, or it can be a little bit flexible. And the whole point is that over the course of 10 weeks at least, we will work with the family weekly on showing them how to implement the targets, and then how to go about them independently, and then we'll just monitor them. And the targets could include anything, but we focus on what's most significant. Yeah, it doesn't really depend on one type of reason why the family is seeking training. It can be for a lot of things. They might just want to support their child at home because they're doing well in school but not performing well at home. So they might want to, you know, improve the quality of life at home as well.
So it is suitable for any, so the brief parent training, if I am a parent who cannot afford to go for therapy, I can be the one implementing the programs for my kid at home. And if I live in a place where it's too far away, can we do that online as well?
Yeah, absolutely. We can, of course, there are some cases where it can't be done online, but most of the time, I think it's very feasible to accommodate, you know, teletherapy or training via Zoom, for instance, or Microsoft Teams. It's very feasible because at some point, yeah, I mean, we might need to model for the kid, but the work is directly with the parents.
Yes.
So they don't need to be physically with us in the
my question now for Christine. Are you still there?
Yes.
Christine,
yes. I want to add something regarding parent training. Parent training, even if we are working directly with the child, parent training is as important because we are temporarily helping the child during a period of time, and the parents are staying during the lifetime with the child. So they need to get the training to continually follow up with the child throughout all his lifetime.
Definitely.
Yes.
And the earlier they start, the better, because it will help. I always find also it's very important to focus on the dad's skills as well as the mom, because a lot of time the mom is doing the right thing and the dad is, why
yes,
he's crying.
Yeah, so it's a shared responsibility for both.
Let me ask you, since you're supervising kids in Lebanon and in Jordan and in Saudi and in UAE, did you find any difference when it comes to the type of challenges and issues that you have in different places, or almost they're all the same?
You mean cultural differences?
Yes.
Yeah, there are definitely. There are also the language preferences also. It depends on where the individual is growing and his environment. So we need to see what language we need to stress on. As you know, individuals in the Autism Spectrum Disorder have challenges in language and communication, and we stick to only one language mainly to enhance the communication. So this is one of the things that we see different in different countries in the Arab world. Other cultural differences are the availability of the parents or the helpers around around in the house who work directly with the child. So those are also different things in different countries. The availability of the parents to work and to implement the recommendations or the work program that is being given. So this is also different among different society or different populations.
Interesting. I'm going to move to one of the biggest issues, and I've seen parents having individuals on the spectrum at the age of 30 or 35, and they say they are hitting their heads on the walls, they are not able to function, they are finding it difficult to keep them at home or keep them outside. Like, it's very difficult for them to manage their maladaptive or aggressive behavior. I'm going to throw this question. When it is an adult, and it's unfortunately in the past, not many people knew what's ABA therapy, and they did not work on many individuals, and they grow up with very aggressive and serious behaviors. Is there something that as behavioral, the ABA therapy can offer to adults, especially when we have aggression and behaviors that are not controllable? You're talking about men who have big size or boys who are above the age of 19 and physically able to hit and break and you know, and it's wearing the families when they have to deal with this on a daily basis.
Yeah. So, I mean, obviously ABA can be applied to any age, any diagnosis, any gender, that sort of thing. So I've worked with a lot of adults with autism, with intellectual disabilities, and nearly all of the adults that I've ever worked with have extremely high rates of challenging behaviors. Because you're right, Dr. Hibba, a lot of the adults that I've worked with got zero early intervention, right? So they didn't get ABA when they were growing up. So by the time they hit adulthood, they're big, they're grown-up size, and they have high rates of challenging behaviors and very low rates of adaptive skills, which makes for a challenging individual. So ABA, I mean, those individuals I worked with, we still worked on their communication and their life skills. We still used positive reinforcement. We still used negative reinforcement. We still used all of these things. But then you get into the crisis management has to come into play if you've got these high rates of intense challenging behaviors. So you have to get trained in how to positively handle individuals for their safety.
So there are structured programs to help parents and to help people who work with these kind of situations like crisis management. Can you describe it a little bit? Because again, I wanted this to be a very knowledgeable session and parents can come out with some, serious information to help them.
Yeah, there's lots of different systems. So I've been trained in a few, and what these systems do is they teach individuals how to physically handle, so how to physically stop the challenging behavior from occurring. So how to restrain, it's, that's what it is, how to physically restrain an individual to stop the challenging behavior and to keep everyone safe, right? And then how to fade out of the physical restraints and what to do before and after. So I've been trained, I was an instructor in professional crisis management. And with that, of course, you look at prevention, you look at how do we stop, how do we make tomorrow better so that we don't see these challenging behaviors. But when the challenging behaviors do inevitably happen, what can we do? How do we physically restrain the individual to keep everybody safe? Because it's part of it, unfortunately.
So let me ask my next question, which is, children at school sometimes engage in some kind of aggressive behavior, kicking the teacher, the chairs, the throwing the computer around them. Do you think like every teacher should have this crisis management training, or behavioral therapists are the one who should manage these cases, or who really can be trained? Anyone? Or it's like, is it something that is available for everyone to be trained on as well?
Yeah, anybody can be trained, and really anybody that's part of that individual's life should be trained. And so, yes, you're exactly right. It's not adults. It's not just adults. It's little kids. I mean, I have had to physically restrain 5-year-olds, right? Because they hurt themselves. They might hurt other people as well. And it gets out of control. So you have to stop the situation. So yeah, teachers have to, anybody in that person's environment, because sometimes it's not just one person. It requires 2 people. It requires 3 people. And the more people, not, you don't want 10 people helping, but if you could have 2 people rather than 1 person, it's better. It's more supportive. It's a better situation for everybody. So yeah,
but it's very important that they got that training from a certified individual who knows how, how to implement it and teach it. Because unfortunately, in the Middle East region, this is not a very common training. This is not a training that you see in most of the centers. The majority of the places that are in Dubai, they don't offer crisis management training, and therefore I know in Maharat, most of the employees are trained on crisis management. We call it something else, but more or less it is how to manage maladaptive behavior. But it's very important that we spread this word out, that if a parent is facing this issue, it is possible for them to be trained and get more skills on how to manage these issues. That will take me to my next question on child protection, because child protection issues there is a law in UAE and Saudi Arabia and almost all the world when it comes to child safeguarding. And what I wanted not to talk about child protection today, but just because when we're talking about restraining and aggressive behavior, we're also talking about issue challenging to child safeguarding and child protection, which is how to manage the child and in the same time do not violate his rights and his safe and well-being.
Yeah, well, I think it comes down to the system that you choose to physically restrain. So there's a lot of different systems out there, and there's a lot of different crisis management systems that do not consider that the individual that you're working with is an actual person, and they have really awkward movements. They cause pain, they inflict embarrassment. So it's very, very important that when you're getting trained and you're choosing a crisis management system and a physical restraint system, that you pick one that ensures that the individual feels comfortable the whole time, and it is not, the premise behind it is not a punishment technique at all. It shouldn't inflict pain, it shouldn't cause embarrassment. It's just a safety measure. It's just to physically stop that challenging behavior so that you can regain control of the situation and support that individual and resume teaching. So it's really important that, so the systems that I've been trained in were created by behavior analysts. So, that all of the different movements are just for safety. So yeah, I mean, but there's a lot of different things out there that should be avoided.
I'm going to move a little bit to technology, and I know who is the expert in technology in this room. So Susan, my question is for you. You work a lot on teaching the parents how to use apps and teaching the therapists on how to use apps for learning. I also want parents, because we have a very great app platform called iEducation, and this is it's where we have put all the apps that any parent will need, books and videos. So can you share some of your experience when it comes to using technology to teach children skills, and what kind of skills usually you can work with when you're using technology?
So as you said, I'm a huge fan of using technology for teaching. And what I always tell parents that yes, we might be using the computer or we might be using it's not just for games. What we're working on is presenting a unique approach to teach specific skills. And to answer your question, the skills could be anything from communication, whether it's like their comprehension or their expressive communication, but it can also include academic skills, it can include play skills, problem solving, visual, and perhaps even the coordination that they need for completing different tasks. And what I absolutely love to use apps for is even to enhance fine motor or to enhance generalization of some of the skills they learned on pen and paper. And what's really good is that we capitalize on the child's motivation. So they don't even know they're working half the time. They think they're playing. So it's just such an inviting medium that they get so preoccupied with all of the sensory feedback that they start thinking, oh yeah, give me that special pen. I'll write whatever you want me to write, or I'll try and pinch these bugs. And so they don't even know that they're working, but they're still practicing everything we would have done on a piece of paper and pencil and with the typical material. And even in classrooms, more and more, we're seeing these amazing websites being used now as part of the curriculum in schools. So why not have that being used at home, where the parents can then also have some control over the way they teach, because they're using something so fun, but they are using something so efficient as well. The child will likely respond to the family and will likely be willing to practice things at home because they don't know that they are actually working just as though they're reading a boring old book. So yeah, absolutely. I think it's a fantastic thing to keep training parents on.
So I'll go to Christine and ask you about the board certification program. I know that you are supervising behavioral therapists to do their board certification. Can you explain to the parents, because as I said, most of the people attending here are parents, and parents are always seeking a BCBA to put down the program for their kids. I want just to elaborate why BCBA is important. What is exactly the skills that you have that nobody else have? Because you do have special education teachers, you have clinical psychologists, education psychologists. Why BCBA and not somebody else? Can you put unmute, please? Christine, we cannot hear you. You are muted.
Can you hear me now?
Yes, I'm muted, so I can give you the floor.
Okay. Okay. So the BCBA is the title that the practitioner or the behavior analyst represents the person who is eligible to practice behavior analysis officially. It is a title that discriminates other professionals or other therapists who pretend or who say they are behavior analysts, but they are not as qualified. So it's basically the title to protect the practitioner, and it's a reference for the individuals to go seek the right professional regarding that. And why the BCBA or the behavior analyst? Because it's a science, as Carrie mentioned earlier, it's a science that is evidence-based and is data-driven, and it teaches academics, social communication, verbal behavior, and the interaction, the person to be able to be included in the society. And it studies the function of the behavior. So we analyze why the behavior is happening and how we can change it. So basically, this is the role of the BCBA, and to set the individualized program regarding, based on the assessment that is carried to the person.
Okay, thank you.
Of course, the special educator has its role, the speech therapist has its role, the occupational therapist, and if we need a physiotherapist. So every individual or a member in the multidisciplinary team has its role, but the BCBA is the case manager or the person who monitors the whole team to provide the proper services to the person.
So, Carrie, when we're talking about behavioral therapy, there are very important elements in any successful program, that it is data-driven, that it is monitoring. Because I have seen people doing behavioral therapy, but they're not taking data, for example, or they work on one program only. Well, I can see that in some programs you work on 10 or 20 programs. So just for parents to understand the difference, that sometimes because there are behavioral intervention approaches, it may not necessarily be an ABA therapy. It can be behavioral intervention where they work on targets. But I think what I've seen also, that many people have done ABA, but they don't take data, they don't monitor, they don't do graphs. And so can you just share with the parents what you think is the basic important things to look at in a good, successful behavioral intervention plan?
Yeah, so I think if therapists are not taking data, then they're not doing ABA. They're saying that they're doing ABA, but they're not. So that's the kind of thing that, it's it's misconceptions. So I think, you know, when parents are looking for a good ABA program for their child, I mean, they need to look at, is it being supervised by a BCBA? So a BCBA has to be involved in that child's program. It has to be data driven. So, you know, we have to make changes according to data. Otherwise, it's not objective. It goes based on emotions and thoughts, and it's not what the child needs. It needs to be functional and age appropriate for the child, and it needs to be based on assessments, right? So there's a baseline taken from a peer-reviewed, evidence-based assessment, and that's kind of what drives the programs. And then what continues with the programs is the data, and that it's being monitored by a BCBA or under the supervision of a BCBA. RBTs are also coming into play now. The RBTs is the Registered Behavior Technician. That's under the umbrella of the Bcba now, and that's pretty standard these days, that the therapists that are actually implementing the programs by the Bcba are Registered Behavior Technicians.
So Nicola, can I ask you, when you're doing an OTE program, is it individualized as well? You're muted. Can you put the mute off? You're muted. Yeah, please.
Okay. Can you hear me now?
Yes.
Yes. So absolutely. Each program is individualized for that child. So
you take data as well? You take data?
Pardon?
Data.
We take data, but it's a bit more qualitative than quantitative. So we will definitely have an assessment at the start, which we would use standardized assessment tools. And then we would tend to not reassess using the standardized assessment tools until 6 months. But within every session, we are taking qualitative data. So how did the child perform? So it's not always did they do it or did they not do it, it's how they did it, which can be important and gives more information about the skills that we're trying to work on.
Excellent. Susan, we're going back to inclusion again, because you deal with school teachers, and school teachers always find it challenging to have a special needs child in their classroom, whether it is autism or other developmental delay. Some of these challenges, what if the child have a behavior in my class? How do I do an IEP? If I'm talking and he's not understanding, what am I going to do? Is there somebody to support me? What are the approaches when it comes to the teacher? As a parent or as a therapist, we depend a lot on the teacher's performance in the classroom to support the child. So what do you tell these teachers? What is there to help them and support them? Do you provide them with resources, with tools, training? You help them with the IEP? What exactly the best way to get the best of them?
So what's interesting, especially in this country, is that inclusion is becoming much more emphasized on or stressed. It's mandated actually. So now more and more teachers are seeking out trainings. There's SEND departments that try to secure enough trainings and support for their teachers. Now, I absolutely love it when schools are open and honest and say, we don't have enough resources to support this child's profile. So we have all the tools necessary to support the skill acquisition of this child within the classroom, whether it's school readiness skills or academic skills, social skills, communication, and of course, how to manage their behavior so that there are no barriers to their learning, regardless of what the skill is. So we're there to support the teacher in that regard. Entire department. And the teacher does not need to have a certificate in special education at all. We can provide everything that they might need. We can provide actual references, resources, we can provide tools. We can even help them, if not write the IEP for them until they understand the child. It's because we know the child inside out. We have data to support, we have baseline data, we have mastery criteria, we're very data driven. So then that's why SEND SEND departments sometimes are excited to work with us because we have everything in a very structured and systematic way. So we are able to provide almost any kind of support for schools and teachers specifically. Yeah.
Excellent. So when I talk about shadow teacher, what is the role of the shadow? I mean, a lot of time we have nannies going with the child to the classroom. And in some of the government schools, they don't even allow a shadow to go in. And if you bring a shadow, I have seen in some school where the child is with the shadow on the trampoline and he's outside the class completely. So what is the concept of having a shadow? And I know what is it, but I wanted people to understand what is the concept of having a shadow to go with a child to school.
Thank you for bringing this up, actually, because I think it's so important to educate parents and teachers alike with how important and unique of a resource it is to have a shadow for this child, 1-to-1 or 2-to-1, full-time or part-time, does not matter. What's important is that we can capitalize on their training, which we always recommend the shadow receive applied behavior analysis principles training in the applied behavior analysis principles, and then also teach them how to implement accommodations and modifications, which is or the IEP. So without that type of support, the teacher will not be able to really provide the right level or type of reinforcement for the child. They'll likely focus on the negatives because they get stressed, they don't know how to manage things. So when a child has that type of need or level of need, then of course we might have to have a chat with the family, with the parents, with the teacher, like this is our recommendation, a shadow, and this type of shadow is needed. Because the shadow that's trained in the principles of ABA, our goal is really, really to fade out. We want to work ourselves out of a job. We don't want to stay there. So we always have specific goals, specific SMART goals, okay? And we try and support the teacher in implementing the IEP, right? And applying a behavior support plan that the individuals such as Carrie, Christine, and we write, and I think it's a good combination to make sure that the child has as successful rather than start with failure and then add a LSA, if that makes sense.
Okay, I'm going to open the floor. We have only 15 minutes left. So any of the people attending this panel discussion would like to ask any question. We are unmuting the microphone now. So Resti, are you there? If we can allow questions to come in.
Yes, they can allow to talk.
Yeah. So anyone would like to ask any question to the panels? And we have a very nice panel of speech and language, occupational therapists, behavioral therapists, clinical psychology. So just shoot your question and we're here to support and answer. We do have one question. Let's see, what is it? I would like to know why it is in UAE so expensive to go to therapies. I have a son with delays and nobody wants to cover the therapy. I'm going to answer you this question. The reason why it is expensive, and it's not only in UAE, I think it's worldwide, because it is 1-to-1. So if the child would take like 20 hours of therapy a day, that means an individual will sit for, it's half a salary of that employee that will go into therapy. The other problem with parents the therapy is multidisciplinary, which means you will need an OT, you'll need a speech, you'll need an ABA. Sometimes other people are involved. When in a place where ours, you have your ABA therapist, but you also have a supervisor, you have a case manager, you have senior staff to overlook your program, and that all add to the cost. Why no one is paying? I hope that insurance, Daman now is covering, and many insurance company were discussing before COVID to cover the ABA therapy. And at the moment, I believe occupational therapy, speech and language, and psychology is covered by insurance. It's only ABA therapy that some insurance like Bupa, we do have few insurance companies that do cover your ABA therapy, but it depends on your company or corporate agreement with the insurance company. Some agreements does not cover that much expense. The other problem is it's new. ABA therapy is not been, it's been in the States for the last 60 years, and that's why it is supported by the government in many of the United States. But unfortunately, it is very new here, and most of the providers are coming from abroad, and that put a lot of cost into it. And so far, it is not recognized as one of the very important policies to be implemented inside schools or in hospitals. It's still additional, and the majority of the services are really skeleton services. You don't have a proper, and there's only one early intervention center in Dubai that is government. So still, this is a very new service sector, and hopefully it will grow over the coming years. I am open to another question. Let's see if we have another question. Nope. Carrie, do you have any question that you would like to raise?
Do I have any questions that I'd like
Yes.
to raise?
Yeah.
No, but I do encourage parents to, I'm sure people have questions that they just don't want to ask right now. So even if, because I think there's an option to do it anonymously, or even if you don't have a question, if you just like to hear more about any particular topic.
And this is what we did because of the COVID-19. I mean, people, it was a challenging time. And I know a lot of people who don't send their children to school or centers or anywhere. They're just staying at home, and mother is supervising the other kids and trying to engage them in their other siblings. What I want to say is we created these online programs to support parental training so that they can do something while they are at home. The brief parent training, we have the online telehealth. We have a lot of things that we are offering parents online. We understand that COVID is a challenge today because the children will never be at this time being vaccinated. So there will always be risk for them contacting the virus. So the parents are worried, especially those who have elderly people living in the same house. This is where we are here today, is trying to give as much as possible to the parents to understand what options they have in front of them. You can get a program, you can get just supervision. You don't have to have the therapist from us, but you can get a program to work on at home. We can train your nanny, you can train anyone around you, your sister, your brother, whoever wants to work with a child. And we just give you supervision. This is one of the options that we offer to parents who cannot afford. We try our best to engage the parents in some of our activities for the kids. Unfortunately, COVID has also hindered us putting a lot of programs in place, like the SABIC Innovation Club. We have the Transition to University program. We have the Special Olympics program. These are all to support the student skills acquisition in technology or in art or in sports. But with the COVID still, it's a challenge for us to go ahead and do some of these programs. We have a new message. Can we see what's the new message? Can heads of inclusion recommend parents take children to the Maharat Center for an assessment if we feel the child is displaying signs of autism? Definitely. Roxy, we are open to any referrals. We have Carrie, Christine, and Sausan, even Nicola and Salma. Whenever there is a need that you want us to look at, we are happy to support. I don't think anyone, we don't refuse to see anyone. We always try to help them as much as possible.
Thank you, Dr. Hiba.
Any other questions?
There's one in the chat.
How can I, as a TA, help my student with ADHD or autism through online platforms, and do you provide RBT training at your center? We did announce RBT training a few months back, but unfortunately we had only 2 people registering, so we had to call it off. I think Christine was running this program, but if we have enough inquiry, yes, we do online RBT. The other question is, as a teacher assistant, help my student with ADD. Yes, we do have iEducation, and iEducation is a platform where we have gathered for you all what you need, whether you are a parent or a teacher or parent, teacher, or a therapist. You will access all the apps that are available to teach different skills from math to our communication, receptive language, all the apps that we could find interesting and worked well with kids. We have put them there together. Some of them you have to pay for and some of them are free. So you are free to go and see iEducation by Maharat Learning Center. It is available on our website and we will post it with this video on our platform. So once we put this recorded session, you will find the link. So hopefully you can also benefit from this platform. Okay, we came to the end of this panel. I thank our panelists. The time flew very fast. It's 1.5 hours. I did not feel it. I hope also our audience enjoyed it. Christine, thank you very much. Christine from Lebanon, thank you very much for joining us today. Sultan, thank you very much for being with us today. You are quite support for the parents and you're always there to help them with anything they need. Carrie is our BCBA in Dubai. At the moment, she is doing the programs. She's setting up the inclusion centers. We do have inclusion center in Bcba and the ISCS school. Coming up Capital School and coming up also British Orchid Nursery. So we have few inclusion centers in mainstream education setting. We also have Maharat in Festival City. Nicola O'Reilly, thank you very much for your contribution. I know that all the kids love OT because of you. And I love to see the kids improving, especially when they didn't write and then now they have learned how to hold the pen. And I congratulate you all for all your successful achievements. Salma, I don't see you on my panel, but thank you very much, Salma. I know that you are the new person to join us, but I believe also you are adding a lot of support to our community of parents. Thank you all very much. Thank you to my dear guests who are with us here today and those who are live following us on the Facebook. Thank you very much, everyone. And our next training will be by Sausan on emotional development and sex education. This is a workshop for parents who are facing issues with their children transitioning to adulthood. It will be done in 2 languages, in Arabic and English, on the 19th of April, on the 21st of April, on the 26th, and on the 28th. So please join us on our next workshop. I thank all my guests. I thank all my speakers. And I wish you all a very blessed Ramadan month coming, hopefully this Tuesday. Thank you very much and have a very good day.
Bye. Bye.
Thank you. Bye. Bye.